to Health Focus, where we focus on your health. I'm your host, Dr. Scott Anderson. June is Men's Health Month, as recognized by the United States Congress and the White House. Dr. David Gramillion of the Men's Health Network refers to what he calls a silent crisis with respect to the health of men in American society today. As he puts it, quote, American men live sicker and die younger than women. In an effort to explore Men's Health Month, we are fortunate to have with us a gentleman who has really devoted a large part of his professional life to an important aspect of men's health, namely fatherhood. Our guest is Armin Brott. Armin, it's really a pleasure to have you here with us today.
I understand you're a former Marine, never an ex-Marine, always a former Marine.
That's right.
And you actually are involved in reaching out to fathers who are in the military through various military radio networks and so forth.
Yeah,
You've written a book on that too, right?
That was it really was one of the books that I felt most strongly about. Is I'd written already The New Father and The Expectant Father and another book on the
you see this one?
Sure. On the school years and the toddler years, and so I was getting a lot of information, a lot of calls from people, and I started to get, not long after 9/11, I started to get a lot more emails from people saying, you know, my husband is deployed overseas, I'm pregnant, how do I help him stay connected with the child? Or I get it from the dads themselves saying, I'm coming back after a long deployment, I haven't seen my kid for a year, how do I get connected up to this kid? And I realized, you know, I've got a lot of fatherhood experience and have some experience having been in the Marine Corps, understanding what the life is like, and I felt that I needed to do that. And so that book continues the same message of here's what you need to be the most involved dad you can be right now. Here's what you need to do at every single stage, before, during, and after deployment. And was lucky enough to be invited to speak at a couple of military bases overseas. I spoke at a Marine base in Japan, and have worked with several Navy SEAL groups, and you know, people who need information. And these guys go into the whole military experience or military deployment thinking that things are going to be one way, and they are not that way. They think they're just going to be able to get ready, and they go, and then they can come back and slip back into their chair. But when they come back, the whole family, after 6 months or a year, however long the deployment is, has figured out how to get along without them for a long time. It's not that they didn't need them, but they're gone. So they figured out mom's the boss now, and so you can't just come in and pick up the way things were. So I really tried throughout all of my work with fathers and also with Men's Health, we'll talk about that more, but to make sure that men have the tools that they need to be able to be the most involved people in their, whether they're taking care of other kids, or their own kids, or themselves.
Yeah, having been in the military myself, I find it hard to even imagine how a person who could be particularly young and enlisted and trying to be a father at the same time. I think if you're a little older, and perhaps if you're a commissioned officer with a few more privileges, a little bit more free time, perhaps, in some cases, maybe it's a different story. But I mean, for somebody who's young, who's suddenly deployed overseas, it's got to be just incredibly difficult. So
it is.
I think that's important. So let's talk about this nexus, though. How does parenting, which is your area of interest, how does it really impact the broader issue of male health? In other words, we have parenting in this area, and we have male health here.
Right.
But really, you can't have one without the other, can you?
No, you can't, and they really do affect each other. Okay. I mean, it starts off with something as simple like, as an example, during the expectant father, during the pregnancy years, men have not years, just 9 months. Feels like years, but they tend to spend a lot less time taking care of themselves. They do not go to the doctor. They tend not to go to the doctor generally at all, but during pregnancy especially, they're much less likely to take care of themselves. And that's because we're the provider protectors. We're supposed to be there for the pregnant wife. That all makes sense. But what happens also is at the same time, expectant fathers and new fathers start looking at the world in a different way. They see dangers, and they see that they need to be there to set a good example for their kids. I mean, for me, I remember at one point in the middle of an intersection, after I had just run what I told the officer was a yellow light, but he insisted was a red light, realizing, I got places to be. I can't be driving like a maniac anymore. And you realize that that's a huge thing. And you start taking better care of yourself. You sell your Harley, you stop bungee jumping, you stop smoking. Those are important things that men do. And then as the kids get older, we we have a tremendous role to play in dealing with the big boys don't cry thing, which I think has done so much damage to so many people, males in particular. But it's, play through it. It's, you don't worry about that, just get out here and keep doing it. Man up, things like that drive men and boys to perform at levels beyond where they should and injure themselves and then not say anything about it. And so we have a situation, as you mentioned in your introduction, where men live shorter, sicker lives than women do by about 5 years, and they die in greater numbers in the younger ages of 9 out of the 10 top causes of death because we don't take care of ourselves. Part of it is a lack of information, and part of it is other things.
Right. In fact, the Centers for Disease Control tracks figures on this, and it's really striking that for the top 10 causes of death, men do die at a younger age. This would include heart disease, cancer, injuries, strokes, and also suicides, HIV/AIDS. And in fact, there's some suggestion that this is true of other conditions too. And I guess the fatherhood issue plays in because of the question of modeling good behavior, as you pointed out, but also in terms of bonding and teaching by example and perhaps creating a foundation of good health in a purely physiological sense as well. So I guess it's multifactorial in terms of the good that fatherhood can do.
Well, it works both ways. It's being a dad is good for children. There's no question about it. The children who grow up with an involved father in their life, they're less likely to get involved in drugs and alcohol. They're more independent. They're more creative thinking. They do better in school. They're less likely to become teen parents, whether that's a teen with a young father or a young mother. That is directly associated with having a dad involved. At the same time, it helps dads themselves. And there's an area that I've worked with the National Healthy Start Foundation in looking at, and that is how dads are involved. When dads are involved during pregnancy, they tend to get the mothers to get better prenatal care. And you know this from your practice, I'm sure, that when women don't get prenatal care, their stress levels are higher. They're more likely to have a premature birth or to have a low birth weight baby. And premature birth and low birth weight babies turn into all sorts of problems that can last a lifetime. But when dad is involved and he knows what's going on and he knows what's happening with him and he can be hands-on and help out and he understands his role and his importance in the child's life, women get better care, which means the outcomes for children are much better. So it really is a delightful feedback loop that getting the dads involved helps everybody.
I'm glad you mentioned motherhood because obviously what we're talking about here is good health that's being fostered by really a community of relatives for young men. We're focusing on men because June is Men's Health Month, right. But many of these things would apply also to fostering good health in girls, I'm sure. Absolutely. And it's also interesting how culturally and on a societal basis the gender roles have kind of evolved. I think when you and I were kids as baby boomers, it was a different scene entirely. We had, for the most part, men who were out in the workplace and women who were caregivers. There were exceptions. My mother was a university professor, and different families have different arrangements. But now you have primarily two adults who are possibly both going to be out there in the workplace, and you also have single parent families. So how do you interpret fatherhood in light of these sort of changing cultural norms that are sort of coming down into society and evolving with time? That must be really challenging for you.
It is really challenging. I mean, I've seen a lot of it. I remember interviewing my grandfather at one point and asking him about, did you wish you could have spent more time with your kids? And he said, well, of course, but who's going to have support of the family at that point? He had 6 kids, and there are things. And what's interesting is that men are much more interested in making changes. I mean, I can tell you from receiving huge amounts of email from men and women about parenting questions. Men are really interested in how to be the best, most involved people that they can. But there is not often the support that they need to be able to do that. There's still a tremendous amount of looking at parenting and health issues, for that matter, as women's issues. And women are the portals through which all of it happens. There was a mentor of mine that once said that a guy will be as involved with his kids as his wife will let him be. And there still is that the moms still often will be the gatekeepers and will say, you got to do it this way. And, the kids have to wear these PJs and this has to be on the plate. And it's very oppressive, and you end up with a guy who becomes mommy's little helper if he's doing it the way that a mom tells him how to do it, as opposed to dad who's figured out what she figured out by making hundreds of mistakes, that there's lots of different ways to do things.
I guess another area we should touch on is the issue of the parents staying healthy. And in fact, we do see, for example, a disproportionate number of workplace deaths due to accidents that occur in men. Women are in the workplace, but there's still probably a higher representation of men in some of the really high-risk careers, such as construction or working as an electrician. In my own practice, I see injured workers, and you can get injured in an office, you can get injured working on high-voltage wires, but for whatever reason, men particularly tend to have a lot of accidental deaths. And I guess part of fostering good fatherhood is fostering workplace safety.
That's true, but it's also understanding a little bit about the culture and where that's coming from, is that we are still raised from the time we're very young, even the millennials are dealing with this, is that men are still looked at as the provider protector. And so that means that you're going to have a lot more men who are going to be roofers or electricians or hazardous waste handlers or long distance truckers or things like that, where you're likely to get injured. And we hear about the men and women of the military, but it's really about 85-15. It's really not the men and women of the military in equal numbers, that men are going into professions where they are likely to get injured. And yes, there's OSHA and there's all sorts of safety rules, but there's also just a lack of caring for that. And
right. I think we also have to care about, as I know you're aware because we discussed this off air, the issue of our young men in our culture, in our society, dying due to homicide or violence, which is still a problem. And the statistics vary widely, but certainly there are some inner city communities in which the risk of being a victim of homicide is alarmingly high. In some neighborhoods, among some populations, the risk of being killed actually is almost as high as the likelihood of dying of another condition. It could be as high as 1 in 30. And we've got to do better there, certainly.
Yeah, I mean, we hear a lot about gun violence, and I think the thing that a lot of people don't know about gun violence is that 2/3 of gun deaths are suicides, and 75% of those suicides are male. And when it comes to victims of violent crime and murder, about 75% of those victims are male as well. And yes, it is, for the most part, it is a male perpetrator as well, but that's not a reason to disregard the problem. There are a lot of things that we need to be paying attention to as far as for what is driving the fact that 3 times more men, or 3 to 4 times more men, depending on the age group, are killing themselves than women. We have some serious mental health issues that have to be dealt with.
Right. And some of these issues are so complicated that they're beyond our scope to cover in a half hour, but let's talk a little bit about what parents can do to foster good health. So, for example, obviously nutrition, exercise, these are important things. And just overall health awareness, I think. Seeing a doctor, seeing a pediatrician, perhaps seeing a pediatrician with your child when the child is still agreeable to that.
Absolutely, and I think making the transition between pediatrician and whatever the next care person is, the next provider is. Girls make a nice seamless transition from pediatrician to a gynecologist or somebody, generally a women's health doctor. So they'll go from 13, 14, they'll just continue on and they'll have continued care for the lifespan. Boys tend to drop out at about 14 or so. And unless they're on a sports team in high school or they're doing something where they're required to have a physical, they may stay out of the medical industry until they're 20 or 30 or beyond that. And there's one of the people on the Men's Health Network advisory board, Jean Bonhomme, he talks about the terrible twos, that we don't go to the doctor in our 20s because we're too busy. And in our 30s, in our 20s we don't go because we're too indestructible. We just think that we're just, nothing's going to affect us. And then in our 30s we're too busy with family, we're too busy with work, and then in our 40s and beyond we're just too afraid to go because we're afraid that somebody's going to tell us that there's some terrible thing, and obviously the way to deal with that, if you're afraid of hearing bad news, you just don't get any news at all. Clearly it doesn't.
Absolutely, I couldn't agree more. Yeah. An example for that would be, I think, colonoscopy. I write a newspaper column, and I wrote a column outlining that most authorities recommend a screening colonoscopy for most individuals. Everybody's different at around age 50.
Right.
And while I was writing this, I was talking to some other doctors, some of whom were men, and many of them were approaching age 60. They'd never had a colonoscopy, and they were in the medical field. You would think they would sort of be more cognizant of this, and there was an element of denial. And we were out shopping at Costco, and somebody came up to me and said, because you wrote that article, I insisted that my husband have a colonoscopy. And
Something.
and some good came of it, yeah.
Yeah.
So,
Yeah, well, if you think about what you have to do to get a colonoscopy, that's not some place that men must want to go.
right. And the disparity in survival between men and women is pretty significant. We're talking perhaps something on the range historically of about 5 or 6 years longer survival among women than men. It varies in different populations.
Right. Well, there's something very similar with diabetes, is a much longer, greater survival rate for women. And that's because, on average, men tend to show up 10 years later than women do. And there's a lot of stuff that can go wrong if you've got diabetes for 10 years.
Oh, absolutely.
That if you would have got there 10 years before, you could have had a much better life, a much different type of life, instead of having to be on
Yes.
medication for whatever life you have left, which may not be much.
There's an irony there, because men, in being kind of stoical and denying that they may have health issues, trying to avoid showing frailty or vulnerability, they may end up actually becoming more frail because of neglecting their health. So, yeah, that's something we want to educate people about. Could you talk a little bit, Armin, about the balance between work and parenting? Because let's say we read your books, we want to be the best parents we can be, but we are working. And we're trying to also particularly foster the health of our children. How do you achieve that balance?
It is really hard, and I think that one of the things that you have to do most of all is to think about the kind of person that you want your kids to be, and to be that person, to set the example, to let your kids see you grieving if you're grieving. If you're a man, if you're a father, let your kids see you going to the doctor to get a regular physical, and so that they see that that's an important thing to do, and stay away from this big boys don't cry thing or man up thing. That it's okay if you're hurting, it's okay to stop what you're doing. And also I think maybe if you're able to do this, have conversations with the providers and see what they can do to encourage. Because one of the things that when I'm working on the books that I've done for Men's Health Network, the Blueprint for Men's Health and the Your Head book, is we've talked to a lot of people about why men don't go, why young men don't go to the doctor. And one of the reasons is silly things that may seem silly, but they say, I don't go to the doctor because when I go there, the receptionist is a woman and the nurses are women and often the doctor's a woman. I just don't feel comfortable talking about this stuff with a woman. Or I go and I'm sitting in the waiting room and all it is a bunch of women's magazines. Where's the Sports Illustrated? And you think, okay, that sounds silly, but if we want young men in particular, to come to the doctor, we need them to feel comfortable in a place where they can come and talk to a doctor. And you as a doctor, I'm sure you would agree with me, I hope you will, that the majority of information that you get for diagnosing what's going on with a patient comes from the patient history. And if the dads and the moms, or the dads in particular, we're talking about dads, are not going to the doctor has only 50% of the information that he needs from a patient history perspective about what's going on with the patient. So the dads have to be involved in every aspect of that.
Now that you mention it, Armin, with respect to denial and concern about that sort of thing, mental health in particular really often is associated with a stigma. And it should not be. We should be beyond that, but it's a reality. And I think you were talking about big boys don't cry. Men particularly don't like to be viewed as being weak or emotional. It can be kind of hard for guys. And I know this is something that you and the Men's Health Network have written a little bit about. This is an owner's manual for your head. Can you tell us a little bit about this?
Yeah, it's looking at depression, anxiety, suicide risk, and every other mental health issue that we could think about, and looking at it from the men's perspective about here are the symptoms that you may be experiencing, here's what you need to do, here's how you need to talk about this issue, and also we talk about the issue of getting help. Here's when to get help and here's how to get help, because that is so difficult for so many men. is to say, I've got a problem, I need the help. And in some cases, like with the military, you probably from your own experience remember this, in the culture of the military, it was excessive in the Marine Corps, but you don't ask for help. The pain, as they said to us, is just weakness leaving the body. So you're not going to be telling anybody. But going to get help, people are afraid that they'll lose their job, that people will make fun of them, that they'll lose their security clearance or whatever it is. And so we need to, as a culture, we need to be telling men it's okay, and we need to tell everybody else, they need help. That women are twice as likely to be diagnosed with depression, but men, again, as I said, were 3 to 4 times more likely to commit suicide than women. There's something going on there.
Yes, and in fact, women see doctors twice as frequently as men.
Even if you take out all of the OB and childbirth stuff, yeah.
So there is an element there of denial. Well, what resources are available to men if they get past this denial and they want to seek help for, let us say, mental health issues? You see a lot of military men or interact with them, and women, and your radio show and in other forums. Do you feel that the resources are there for them, either in the civilian sector or in the military?
I think the resources are there, but I think that in many cases, the people who are providing the resources don't even know that they're there. That a guy can go to get a physical, and he may not talk about having a heart problem or having erection problems, sexual difficulties, because they're embarrassing to talk about. So we need to figure out ways of training the providers to ask the right questions so that they can get the right sorts of information. They need to be doing mental health screenings with patients who are coming in. They need to be asking personal questions, because that's the only way that you're going to get people to talk about it. So, and then once a physician or a provider knows that there's an issue, they know where to refer them.
Okay, well, since you broached the subject and we're talking about Men's Health Month, let's talk about some uniquely male health challenges. So, for example, prostate cancer. Prostate cancer now is the second leading cause of cancer death in men. The number 1 cause being lung cancer, and number 3 being colorectal. The top 3 causes of cancer death in women are lung cancer, breast cancer, and colorectal cancer. We may hopefully see lung cancer drop to a lower and lower level, since 90% of it is caused by smoking. But in the case of prostate cancer, there have been a few high-profile cases that I think have increased our awareness of this problem. For example, there was General Schwarzkopf, who was in the military, who had prostate cancer and was open about his experience. Senator McCain, who I think is battling another cancer condition now. But by and large, historically, that would be the kind of thing that many men would keep quiet, because the prostate gland is involved in sexual function. It produces secretions that are part of the ejaculate, and therefore it's really intimately tied to our sense of masculinity. Do you think we're making progress in getting people to be more aware of the need to be screened for prostate cancer?
I think we are, in a way. There's more media attention, as you're talking about, and because of June being Men's Health Month, and then there's Men's Health Week, which is the week right before Father's Day, that people are a little bit more aware of it. But I'll give you an example of what's going on. At the same time, there's the United States Preventive Services Task Force, which evaluates procedures, and they decide whether they recommend or they don't recommend certain kinds of procedures. And one of the ones that they are giving a C recommendation to, which is you can talk to your provider about it. For men up to 59, they say you can, about this, the PSA, which is a prostate-specific antigen. It's a blood test, so it doesn't involve a rectal exam, which is the same issue with the colorectal cancer screenings. And so that is being essentially recommended against. And for men over the age of 70, they give it a D rating, which is they're saying it does more harm than good. And with the Men's Health Network and other advocacy groups who talk about this and say, look, men need to have information. And the best way that they can figure out where they are is to have a PSA at about 50, unless they're African American or have been in the military and had exposure to Agent Orange or some other chemicals, which means their risk factor becomes about age 40 when they should start getting. But they need a baseline, and the best way to get a baseline is the PSA exam. and you have a government agency or government-funded agency which is essentially recommending against it, and that's not terribly helpful. So providers are put into this position where they don't know whether they can recommend it or not, and because of the D rating in particular, the people under the ACA may not have that covered. So they're being denied access to a very basic and very important screening tool.
Right. In fairness to the sort of oversight agencies or groups, there is an honest difference of opinion based on medical research in some of these groups. For example, historically, urologists tend to be very oriented towards surgery. Mm-hmm. And so the urology professional organizations tend to really support aggressive treatment for both biopsying and diagnosing prostate cancer. The internists, I'm in an internal medicine field, our group, the American College of Physicians, I don't speak for them, but I believe they have expressed a point of view which is more conservative, and there's some data to suggest that watchful waiting or being less aggressive can be helpful for prostate cancer. So we're going to have to see where that goes. Another issue is testicular cancer. Now,
Less controversial.
Less controversial, but even less appreciated. Testicular cancer is actually the most common solid tumor between age 20 and 54. But do we ever hear about it? Do people ever talk about it? And yet...
Lance Armstrong was about the last one we heard about.
Right, there was Lance Armstrong. But this is a curable cancer if it's detected early. And we know that, for example, women are encouraged to do self-examination of the breast. Mm-hmm. There's a comparable examination that boys could be encouraged to do on a monthly basis. Yeah. But I don't think that the word has gotten out on that. What do you think, Armin?
No, I think that it's not commonly discussed. And that's partly because of what I was talking about before, that big dropout period where boys, at that point, right around 14 or 15, when that becomes a cancer that starts showing up, they're not anywhere near a doctor. And nobody is telling them. Their fathers don't know how to do a self-exam because we never heard about it ourselves. And the mothers are not going to be teaching the boys how to do a testicular exam. So they don't hear about it until it's a problem, when they're having serious medical issues and they go to the doctor finally and they find out. And too often they find out when it's in an advanced stage. But yes, and that's one of the resources that Men's Health Network has that they can get from the website, menshealthnetwork.org, by the way. There we have called a shower hanger. It's a plastic coated kind of a thing that you hang over the shower, or a doorknob that shows you little pictures and also words about how to do a testicular exam. It takes you about 2 minutes. Mm-hmm. And you should probably do that every month so that you can get a sense of what your body is supposed to feel like in its normal state, and then you'll recognize something if it's not feeling right.
Right, and if it is detected early, it's curable in many cases. So that's the good news about testicular cancer.
Yeah.
And it's interesting that cancer deaths have declined due to better screening and better treatment, but cardiovascular deaths have declined even faster, the deaths due to heart attack and stroke. So, for example, in California, and in fact in 22 states, cancer has become the #1 cause of death. It has superseded heart disease, and we'd like to make more progress against cancer. But with respect to heart disease, the other thing is what's called secondary prevention. That means you're healthy, you're doing well, but you have high blood pressure, high lipids, high glucose. We really want to encourage men to get those things addressed too. And that can occur at a young age, particularly with our obesity epidemic.
Yeah, and that's one of the things that I'm sure you would support this too, is that one of my big messages, whether it's Men's Health Month or Men's Health Week or just any other day in the middle of March, it doesn't make any difference. You need to make some sort of contact as a man, a young man, with a medical provider, and have some ongoing contact with this person, because you meant the things that you mentioned, blood pressure, lipids, cholesterol, those are things that you can't find out on your own. You have to go, and somebody's going to have to order a blood test. And that's how you find out, and it's the baseline that I was talking about with the PSA, but it's a baseline for any type of a thing, is you want to find out what's your, as a 16-year-old in wonderful health, what's your cholesterol?
Right.
And then once you know that, you can tell if it's high or low moving forward. But if you don't go until you're having heart palpitations, or the first time you go to the doctors when you're age 35, and your blood pressure is 180 over 100 or something like that, or your cholesterol is 250, who knows? I mean, it's a problem.
Right. So we're talking about not just treatment for specific conditions, but building a relationship of trust, what some have called a therapeutic alliance, and that's so important. And these kind of relationships can be harder for guys to build. It's just not necessarily in our DNA to be intimate with another guy and to say, you know, I'm worried about this, tell me how I'm doing, keep an eye on this. That's something that takes a little work.
It does, and it takes work on both sides. I think
Right.
that the providers have to make some outreach and really encourage young men to come in and do whatever they can to have services, to have, whether they have a barbecue or whatever it is, that you can get guys to come in and encourage them to take more of an active role, because that's what ultimately we want, is we want adult men to take better care of themselves, but we want the next generation. We want our kids to be able to say, you know, I'm not feeling good, or you know what, I need to get, I just saw this article, I just saw this great show with Dr. Scott, and thought we heard about how we ought to really get out there and maybe I should get my blood pressure done, or whatever, you know, to start that relationship. And you know, you're not going to be going to see somebody every week. You're talking about once a year.
Right. And if you're just joining us, we're focusing on Men's Health Month, and my guest is Armin Brott, who's a prolific author who has published extensively on men's health and who works with the Men's Health Network, and particularly works with our men and women in uniform and tries to foster fatherhood as something that's really important for our society. And, you know, as we begin to wind down our interview, I'd like to ask a little bit more about the Men's Health Network.
Sure.
I understand that there are some activities being sponsored, one of which is, I believe, Wear Blue Day, which is the Friday before Father's Day. I think it's June 15th of this year. In honor of it, I'm wearing blue myself. I see you have a blue shirt.
Slightly blue, yeah.
So can you tell us a little bit about the Men's Health Network and the work that they do to foster good health in men and boys?
Well, Men's Health Network's been around for about 25 years. And actually, I think it's exactly 25 years. This is the 25th anniversary year. And it's a nonprofit education and advocacy-based group. And so we work with churches and faith-based organizations all over the country. A lot of the work that we do is screenings and making sure that there are places where people can have them. There was a wonderful one we used to do with the Washington Redskins at the Redskins Stadium, where we had the Washington Redskins cheerleaders were there, and we had a number of veterans organizations and health organizations came and had it set up in the locker rooms so guys could have, an example of what I'm talking about, how to get people in, is, well, you got an opportunity to see the cheerleaders up close, or to hang out in the locker room where your favorite players are getting, you know, there's their locker over there. Things like that help to bring people in. And so we have screening. So we're doing blood pressure, we're doing PSA, we're doing cholesterol. Grip strength is a major predictor of whether a guy's going to develop osteoporosis, which is something that we think of as a women's condition, but it also affects a lot of men. So screenings, and we do those in Congress. So we also worked with Congress and Senator Bob Dole at the time and Bill Clinton to pass, you mentioned that in the very beginning of the show, to pass Men's Health Month as an actual congressionally legislated piece of legislation. And so we're out there working, coming on shows like this one to educate people about the importance of men's health to men themselves, but also with the old adage of a rising tide lifts all boats. When you've got healthy men, you're going to end up with healthier families as well, and that's what we want.
If someone really doesn't read your books and doesn't really go into the detailed analysis of this issue, but just wants a few guidelines, could you give like 2 or 3 suggestions that are just simple that our viewers could follow that would foster successful fatherhood and maybe overall improve male health?
Yeah, I think for successful fatherhood, I think the most important thing is close your eyes and jump in, and don't be afraid of making mistakes. The only way that you're going to become a competent, confident father of a child at any age is by starting to make mistakes. Kids are remarkably resilient little creatures. They'll get over it.
Right.
Nobody's going to be perfect, and stop thinking of needing to be perfect. For men, I think the things that you mentioned earlier about nutrition and exercise have been shown over and over again to be the most important things. That if you can start eating right and start getting some exercise, that's going to help. And then there's the third component, which is, I don't know if you want to rank them, but it's certainly one of the top 3, is making that relationship with the provider so that you have somebody that you can talk to about the health issues that you're worried about, or somebody that as a parent you can talk to about health issues that you're concerned about with your child. Having that as an important component is going to be, I think will make it easier for people to take a more active role in their own self-care and to help other people as well.
How do you think we're doing as a society in terms of fatherhood? Do you think things are getting better? Getting worse?
No, I think we're getting better. We're getting a little bit better. There is support. But there was a study, I tell this to the guys I teach classes for expecting fathers, I tell this to the guys. There was a study that wasn't done long ago, and it was asking how much time is it reasonable for a new father to take off after the birth of a baby. And this is a study of Fortune 1000 HR directors and CEOs, and 40% of them said none. So we still have...
We've got a ways to go. Well, we've scratched the surface of Men's Health Month, and I would just like to thank our guest, Armin Brott, for really shedding a lot of light on this. It's just been a pleasure to have you on the show, Armin. And remember, here at Health Focus, we focus on your health. So until we see you next time, stay healthy. Thanks for joining us.